Look, we have talked a few times about the situation, the problems with nursing in this province. First of all, for people working in the profession. But then lately, the bigger story has become people trying to get into the profession, specifically failing that test now. And it's become a big enough issue. The government got involved. And now we're finding out, based on a study from the Montreal Economic Institute, that the problem is maybe even bigger than we thought originally, concerning people leaving the province. So let's try to find a little bit more here. Emmanuelle Faubert is author of the study. She's an economist at the MEI and is on the line right now. Emmanuelle, thanks so much for being here. When I say the problem is worse than we thought, the figure that jumps out at me initially is half of young Quebec nurses are leaving the profession before the age of 35. So what's going on here exactly?
Exactly. So what we found is, taking an average from 2016 to 2021, for every batch of 100 new young nurses that enter the market, that enter the system, we have 44 of them that leave before the age of 35. And it's a lot, and it's worrying when you see that we need these young nurses in order to have a healthcare system that works long term. After all, they are the backbone of the system.
The first thing that comes to mind for me is working conditions. Obviously, pay is probably an issue as well, but, we've heard so much about forced overtime. What are the reasons that these nurses are saying, no, I don't want to do this anymore?
Exactly. So the biggest issue is overworked, is being overworked. So as a FIC, which is, they did a survey for over almost 10,000 nurses, and 71% of them were saying that if they were to quit, it would be because of being overworked. And basically, it's a lack of flexibility, and the working conditions are bad. And when you have young nurses entering the system, they are at the bottom of the echelon, so they get stuck with the worst shifts. So the evening and night shifts, the weekend shifts, and even weekend night shifts. So they end up getting into a burnout and eventually leaving the system altogether.
So I'm curious, because you said from 2016 on, so we were way pre-pandemic in 2016. Numbers for the last 3 years, when it got worse than it's ever been before, are they different?
Well, the data that we have stopped at 2021, but in 2020, it was astronomical. It was over 60% that left before the age of 35. But after that, in 2021, it went back down to almost 40%, which is more the norm, but it is more than it was before. So between 2011 and 2015, the average was at 37. Well, now we are at an average of 44, so that's still an 18% increase. So it is a tendency of going up.
Emmanuelle, to me,
worrying.
It's very worrying. We're already in a crisis right now. It's hard to imagine how it could get worse, and that it's obviously going to get worse in coming years. I wonder again just how these numbers, these statistics that we're stating, speak to a bigger problem. Like there's a societal problem in how we value nurses, and I would have thought that it would be better within the system, but it sounds like that's not the case. So what needs to change here? How can we begin to fix this?
Well, unfortunately, it's not something it's not one decision that is going to fix everything. But what we know is that they really need more flexibility. And what is happening right now is that it might get even worse in Quebec because of Bill 10 and Bill 15. What Bill 10 and Bill 15 do is that, one, they limit the use of placement agencies, and two, they make Santé Québec the only employer for nurses. So what happens if there's an overworked nurse that doesn't want to work for the government anymore? Before, they were able to change job, and often they would go through these placement agencies. But if that option is removed, that safety net is removed, the government is saying either you work for us or you don't work as a nurse at all. So this might force even more of them to leave the system, which would really worsen the situation.
Yeah, I'm trying to hear where the possible solution is. We've heard the various problems, and you're right. This idea now of the government being, against this idea of losing nurses to the private system because so many are leaving the public system. Where is the solution? Is there a fix anywhere in here that you can see?
Well, that's something I think has to be done locally, which is why we need for every healthcare establishment to have the flexibility to figure out something, to try different avenues. And if they figure out a system that works, and also let's never forget that each establishment has different needs in terms of different the people that work there, and the patients are different, so they have different needs. So once they figure out a system that works for them, maybe that can inspire other healthcare establishments into figuring out what works for them. But this is something that has to be done locally,
right,
and it has to be decentralized. It's not someone in a tower in Quebec City that knows better than the people that are on the field.
Yeah, which is what
Very
nurses
much.
have been saying for the longest time,
well,
right?
But I'm also thinking the nurses themselves know. And so to me, there needs to be like a culture change within the profession also, because the senior nurses, obviously, when you've worked that long in a field, you should be granted some things should be a little bit easier for you. You should get better shifts, I suppose. And yet it seems to me I don't want to use oppression's probably too hard of a word, but they're not making it easier for the new ones to come in, which then in turn makes it harder for them because they are going to then end up with the harder shifts. So all of this to say, I feel like there needs to be a shift within the nurses' culture themselves. I don't know if I'm making sense, Emmanuelle, but do you know where I'm going with that?
Totally. There is a generational clash between the experienced nurses and the new ones that are entering the system. And we don't want to make the situation worse for the older nurses, because indeed they have won their right to have those day shifts, I know, but in a situation when we're losing almost half of our young nurses before the age of 35, it cannot work anymore. We have to change something in the system so that they want to stay. It's not by what we can do to force them to stay. We have to find the right incentives so that they would choose to remain in the profession.
You know, I brought up when we started the piece, Emmanuelle, this idea, of course, beyond this part, the part about people who even want to get into the profession and the whole, I call it a scam, the whole, I guess, debacle over these nurses' tests. I know this doesn't play into the research, the numbers you have here, but I mean, that has to be as big a concern. These are people who want to get into the system and can't even do that.
Definitely. I will not get into the skills and who should be allowed and not, because I am not a healthcare expert. I do not have the skills to know where the bar, how high or high low the bar should be. Mm-hmm. But when we have a very high number of nurses, especially when they do like these CJEP programs or professional programs that fail these exams, it is pretty worrying indeed.
I think you're doing really important work by highlighting these numbers, and especially what you said about someone in a tower in Quebec City isn't going to be able to solve the problem from there without knowing the reality on the ground. So you're making sure that some of that reality is being known. Thank you.
Yeah, thank you so much, and thank you for breaking it down for us, Emmanuelle. We appreciate it.
Thank you for having me.
You bet. There you go. So that's the situation with nurses. It's not any better than we could have imagined. I think it might be fair to say it's worse. Let's see what the government ends up doing in this particular case.